Hi everybody, Andrea Twarowski here with Dentalelle Tutoring. I've been getting some more questions lately from actual hygienists who have started working. So a lot of the emails are from new hygienists who are just simply asking some questions, and I totally understand that because even when I was a new hygienist, I had questions, things like, what do you suggest I wear to an interview? Things like, it's my first day on the job, like what can I expect? What types of questions should I be asking? If they ask me how much I want to get paid, what do I say? Because you don't want to go too high, you don't want to go too low. But then as soon as you actually start working, that's when a lot more questions, I guess, may come about. Like you might be asking, how do I know what to post for the appointment? By posting, I mean if you are in charge of putting things through on the computer for the receptionist, well, you have to have an idea of how many units to bill for a scale for a polish. Do you take x-rays every time? Do you not? If it's a 45-minute appointment, how much do you bill for polishing and for scaling? Because it's not as simple as, you just always put the same code through for all patients. It depends literally now how much time you actually spend, because now they're getting more sticky on record keeping, where as a hygienist we now have to put down exactly to the minute how many minutes we spent scaling, how many minutes we spent polishing. So this is what I want to talk about. So I want to talk about units of time in the video today. I'll try to keep it short and sweet because I could talk about this forever, and I completely understand people having this question because I didn't know too much about it when I was working in the same office for literally like 13 years. Because at that office, we would bill the same for everybody, pretty much. If they were in for their 40-minute cleaning, because we did only have 40-minute appointments, which is not a long time, but anyways, it depends on the office. We would just always bill, and I'll let you guys know. So we would always bill 1 unit of scale, 1 full unit of polish, and a checkup code if they were due for their checkup. If it was only a perio appointment, we would only bill that perio code. And I didn't think anything of it because that's just something that the office always does. But now that I've been working in other offices, it's amazing because we weren't billing enough. But let me first say that it depends on your office if 1 unit of time is 10 minutes or 15 minutes. So ask the office, because that office where I was first, a unit of time was 10 minutes. Whereas I'm noticing now, like I've been in about 3 or 4 other offices since then, a unit of time is 15 minutes. So that makes a difference. So remember how at the other office I said that we only billed 1 unit of scaling? Well, that's 10 minutes. That's not a long time. It would take me 10 minutes to do maybe a quadrant if there's not a lot of plaque there. So if you think about it, for a 40-minute appointment, if I'm billing a unit of scale and a unit of polish, that's 20 minutes. So what am I doing that other 10 minutes? Well, that does probably include the checkup, and it does include, OHI instruction, if you're doing the perio probing, things like that. But was I scaling for only 10 minutes? No, it was pretty much, I was doing a full scale for at least a half an hour. I was usually behind, so I'm just being honest. I was usually behind at least 5 or 10 minutes, but I would be scaling for at least a half an hour now that I think about it. And then the other 10 minutes, I would be waiting for a check, talking to the patient. Oh, but I forgot the polish. So a polish usually takes about 5 minutes. So was I spending 10 minutes on a polish? No. But back then, we didn't have to write down how many minutes in the chart we spent. So if it made sense with the appointment, and in a way it does make sense. For a 40-minute appointment, it makes sense to do, a unit of scale, a unit of polish, because that's 20 minutes. But then for the rest of it, am I talking and doing OHI and the recall exam? Well, I guess that could happen, right? But in the chart, if you were to put down exactly those codes, so at that office, a unit of time was 10 minutes. So I would have had to put down scaled for 10 minutes, If it was 11 minutes, put that down. Scaled for 11 minutes, polished for 10 minutes, and recall exam. So that would have made sense in a 40-minute appointment, but it doesn't make sense when you yourself think about it. Were you only scaling for 10 minutes? Was I only scaling for 10 minutes? No, no way. So that office is definitely undercharging because, yeah, there's just no way. You can ask any hygienist out there. They are scaling for more than 10 minutes. But the offices that I'm seeing now, a unit of time is 15 minutes. So a reasonable, if you're asking this, a reasonable amount to post and a reasonable amount to scale. And I have, as a hygienist, many years experience. So for me, a reasonable time to scale is a half an hour. So if your office has a unit is 15 minutes, so that's 2 units of scale, which depending on where you live, this may not apply to you though, so keep that in mind. But for us here, 2 units of scale is 11112, that's the code, and a half a unit of polish. 11107 is half a unit of polish. So if the office where a unit of time is 15 minutes, if I'm doing half a unit of polish, I don't know, that's about 6-7 minutes, I guess, if you want to put that down there. So that's reasonable, but you're probably polishing for like 2 minutes. But, you know, like half a unit, you have to sort of do the math, I guess, in your head, and it does get easier. But first, you have to know how many units of time your office works on. It could be 10 minutes or it could be 15. But to keep it simple though, which I should have said at the beginning, so I'm sorry, but to keep it simple for a new hygienist, look at the previous notes in the chart to see how much that hygienist has been billing for scaling and polishing. So let's say their last appointment was a perio appointment, and you see the codes in there for 11113. So that's 3 units of time. So let's say in that office, a unit of time is 15 minutes. So 3 units is 45 minutes. So they would have likely had a perio appointment that last appointment, because a perio means that the dentist doesn't come in to check. And a perio also means that you do not charge for the polish, because a polish is not covered at a perio appointment. I'll talk about this more in another video, but a quick side note is some offices still polish at every appointment, so even at the perio, but they don't charge for it. Some offices though do not polish at that appointment, because if you're not charging for it, then legally and technically you shouldn't be doing it. I like those offices because polishing does take my time. So if I'm putting down that I am scaling for 45 minutes, I should be scaling for 45 minutes, right? But if you have questions about that, let me know, but I will put that in another video too, just to make it, you know, make more sense. So if your appointment is for a perio with your patient, and you notice at every single perio appointment, they have been charging the code 11113 for 3 units of time, you should be doing the same thing, you know, because if you charge 2 units of time, half an hour, your patient's thinking, oh, how come it takes her less time to clean my teeth? It's less expensive. Well, I just would like to see her then from now on. That may not be the case. It's just you may not know how to post properly, or you're new and you're not, you know, checking your work, you know, who knows, or it could go either way. So let's just say that, right? But then let's say you look again in the chart, and let's say for a recall and a cleaning, they always charge a 01202 for the recall exam, and they charge, let's say, 2 units of scale, so 11112. They charge a half unit of polish, 11107. And let's say they do fluoride as well at every recall exam, and that's the code 12101. So at your recall exam, you should be doing the same thing. So look at the codes that were posted before. If you're not sure, if you have questions, just ask. because even I've looked in the chart sometimes for certain offices, and I see, okay, well, sometimes they charge this, but then last time they did a completely different code, but then the time before that they charged more, but then the time before that they charged less. So it tends to get confusing sometimes if the patient has seen multiple hygienists. But the best thing to do is look back and see what the patient has been charged in the past. And an example of that is, like, I was temping at another office where they do a fluoride treatment at every cleaning and checkup. So not at the perio appointments, but either every 6 months or every 9 months at the cleaning and checkup for almost everybody. I wasn't used to that. Like, I was used to only doing fluoride on children. So I didn't even think to check or to look or to ask if I should be giving a fluoride treatment to adults. But once I started looking in the chart, I noticed that code at every cleaning and checkup. So I thought, oh, well, then I should be doing the same thing, right? So look back in the chart to see the codes that have been posted. And a quick note also, which I'll probably do another video on this too, are x-rays. When do you take x-rays? That depends on the office. I have been in offices where you would ask the dentist before the appointment each time if they want the x-rays. So it could be done once every year, once every 2 years, once every 3 years, once every 9 months, who knows. But the office where I've been temping at recently, they do checkup x-rays at least every year, 4 of them. Some offices do 2 bite wings, some offices do 4, so check with the office what they prefer. But they do x-rays also every 9 months if at the last appointment they had a cavity. So, and that to me makes sense, you know, if they have checkup x-rays, say, every year, but every time they come in they have a cavity, if you started doing the checkup x-rays every 9 months, then possibly you'd be able to catch that cavity as it was still an incipient, and then let the patient know, okay, you have a couple incipients over here, brush well, and then hopefully the next time we see you, it won't turn into a cavity. So those, I find, are the common questions, and they are excellent questions. Because if you haven't worked in an office before, you may not think to ask those questions until you have the patient in front of you, and then you're like, oh shoot, how do I know what I'm doing today? How do I know how many minutes to scale for, how many minutes to polish for? And even if you've been doing this for 10 years, and if you start in a new office, your past office may have done things completely different. Like, can you imagine if the office where I was temping at, if I did a unit of polish and a unit of scale for everybody, where they normally charge 2 units of scale, half a unit of polish at a cleaning and checkup, but at the perio, they charge 3 units of scale. If I charged only a unit, they would be like, whoa, 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 like, you're losing money, you know, like, you were costing us money. Why did you do that? You know, so it makes sense, because yes, a dental office is a business. It's not all about business. It's about the patients first, but second, it is a business. I mean, if I owned a dental office, I would be upset too. If I had a temp hygienist coming in and only charging a unit of scale, when for like 20 years, that patient had 3 units of scale, I'd be like, okay, so are you actually only scaling in 15 minutes? If you're that fast, we don't really want you here, because you can't be doing a good job. You know, think about it that way. So I hope that helped. So we talked about units today. We talked a little bit about x-rays too. I'll probably do a couple other videos on that, but I do hope that helped. Units of time and office depending can be very confusing. So if I didn't explain things properly, please let me know. And thank you so much. I think I had actually about 2 people ask that same question. So thank you so much for asking the question. Thank you for emailing me, because I think that this will help a lot of people. So if you guys have any questions about units of time, or if you have any questions about anything else, let me know, because if you've been watching the videos for a while, you can see that I will answer anything. I will be honest with you, because I had wished when I had first started that people were honest with me. So, you know, this is an amazing profession, but if you're not properly informed, you can experience burnout. You can experience the, why is nobody listening to me? You know, you could experience the, you know, why do I feel like I'm never doing anything right? It happens. So if you're new, try to avoid that by asking the questions. So let me know if you guys need anything, and I will see you guys in the next video.